AIMS Mangalagiri is a premier medical institution in Andhra Pradesh state, madam. It was established in 2018, yet it remains starved of essential funds need for the maintenance and expansion of existing facilities, madam. Due to the lack of funds, hampers the institution's ability to attract top-tier medical professionals and researchers, madam. Madam, whereas SWIMS Institute in Tirupati started its services in 1993 and has established itself as an eminent effects services provider over the period of 30 years, madam. Approximately 95% of its patients come from low socio-economic backgrounds, madam. The government of Andhra Pradesh has already sent a proposal to Union Ministry in August 2023, madam, for INS status purpose, madam. In this regard, madam, I request to you through Honorable Minister, madam, to look into this matter and ensure the financial support and further 10 acres of land for the AIMS and INS status to the SWIMS University, Tirupati, madam. And second point is, madam, the reduction of allocation for PMSSY in the 2024-2025 budget is a significant concern, madam. From 7,517 crores in 2022-23 actuals, the budgetary allocation this year is only 2,200 crores, madam. The reduction in support from gross budgetary support compared to 2023-24 threatens to undermine the program's primary objective of correcting regional imbalances in tertiary healthcare services and medical education, madam. Madam, like other primary institutions have been granted INI status, if INI status is given to SWIMS University with the central government aid, the institute can extend its advanced healthcare services for the patients of low socio-economic backgrounds in the underdeveloped Rayalaseema region, south and coastal districts of Andhra Pradesh, and for patients from Karnataka and Tamil Nadu also, madam. Third point, madam, allocation for the National Tele-Mental Health Program in 2024-25 is woefully inadequate, madam, with only 90 crores allocated, madam. The increase from the various previous years is marginal and fails to address the escalating mental health crisis post-pandemic, madam. The fourth point is, madam, the government insufficient capital outlay of medical and public health and family welfare is majorly policy mismatch, madam. The allocation of only 3,510 crores for medical and public health is alarmingly inadequate, madam. Madam, in the year 2020, approximately 8.5 lakh deaths were recorded due to the cancer, madam. The rate of death due to cancer is increasing drastically in India, madam. Not all people have access to cancer screening. At the same time, in my parliament segment, with a collaboration with SWIMS University, we have started 2 mobile cancer screening units, madam, in February 2024, and screened 60,000 people, madam, in their location only, madam. Among them, almost 850 cases were identified as positive, madam. We referred to cancer center, SWIMS only, madam. The cervical cancer is one of the leading cancer among women, madam, in India, primarily due to HPV virus infection, madam. There is a need to allocate sufficient resources to initiate mobile cancer screening and immunization units for cancer screening and immunizing women against HPV in urban, rural and tribal areas across the country, madam. As SWIMS Tirupati has been providing cancer care services for the past 20 years, and recently it has upgraded with a dedicated cancer center, Sri Balaji Institute of Oncology International Center for Advanced Cancer Research with state-of-the-art infrastructure and high qualified professionals. Hence, I urge the government to grant the status of National Cancer Institute to Sri Balaji Institute of Oncology, madam. And the fifth point, madam, the government Under funding for emergency preparedness in the health sector is deeply concerning, madam. The allocation of health sector disaster preparedness and response has seen a significant decrease from 128.14 crores to almost 90 crores, madam, in this budget allocation, madam. This reduction is alarming, madam, especially given to the frequent occurrences of health emergencies, including pandemic and natural disasters, madam. And also sixth point, madam, in India, one of the world's largest exporters of pharmaceuticals, exporting nearly 50 to 55% of pharmaceutical productions, madam. This high export rate highlights India's role as a major global player in the pharmaceutical industry, madam. About 90% of the medical implants used to India are imported, madam. I urge the Union government to establish an innovative medical hub to develop indigenous medical implants in Tirupati, madam, Andhra Pradesh. This indigenously developed medical implants will be cost effective and our nation also will become a global competitor, madam. Last point, madam, the government budget allocation for 2024-25 towards establishing new government medical colleges is severely inadequate, madam. Despite us having a highest percentage of young population, the number of Indian medical students studying abroad has grown by 20%, madam, since 2016. While domestic growth remains a mere 3%, we are the second largest source of international students, leading an economic and the brain drain costing the national approximately of 1% of GDP, madam. Last point, madam, the death of doctors comprised a merit and the injustice created to be addressed, madam. The previous Andhra Pradesh government led by the Chief Minister Sri Y. Jagan Reddy Garu understood this need of the nation and planned to instituting one medical college for every district in Andhra Pradesh, madam. I request the government to increase the number of seats in government medical colleges as well as set up a more medical college across the country, madam. Thank you, madam.
माननीय सदस्य श्री मियां अल्ताफ अहमद जी।